So nice deep breaths, okay? If you find this is too strong and you feel like you're tensing up, then I'll ease things up. But if you're able to bear with it and you're able to kind of not tense up, then we're in the green zone, okay? No, you're actually doing really well. Just nice deep breaths, okay? Okay, you're doing really good.
It's like when you hit the side is just so painful.
That's where it's worse, yeah? Okay, so that's an indication that your stretching needs to be focused on your lateral hips. Okay, so I'm going to take you through some passive stretch today to show you how to do that. Just right there, yeah? Nice deep breaths. You're doing really good. So pigeon pose, what you're going to do, you put your foot up onto the bed. So I want you to pop it up like this. That's it, perfect. And I want you to bend forward at the hips. So try not to curl your back. I want you to bend forward at the hips. So you're going to go from here and you're going to lean forward like that. Okay? That's it. So drop your leg back and I want you to lean your body forward. And try and make sure that that's happening at the hips and not at the back. Can you feel that?
Here.
Exactly. That's exactly where you want it to feel. Okay, and what I want you to do with here, I want you to literally just reach out. Okay, stretch out as far as you can. Nice deep breaths in. Okay, and with this pigeon pose stretch, you can follow it to the T like I'm saying to you, or you can do what I would prefer you do, is you play with the stretch. Okay, so what I want you to do is literally move your angle around now. Okay, so we're going to turn this way a little bit. Okay, so we're going to change to kind of 45 degrees and you're just going to literally stretch your body out. Again, trying to push your hips backwards so you're tilting and tipping at the hips. Okay, can you feel that happening?
Yeah, I can feel it, yeah.
Okay, and you can come all the way around. Okay, so you want to come now to this angle a little bit. Okay, and then all the way over this way as well. Okay, so you're going to just alter those angles as you go around. You can do this on the floor. Can you imagine how you do this on the floor? The leg straight back out and you're going to just turn this inwards like that. Okay, and again, just playing yourself out and just getting a good stretch there.
Should I do it?
Yeah.
I can feel it proper pulling, yeah.
Yeah, so the areas where you feel it hurt more, where you feel it pull more, are the areas where you actually need to stretch. Okay, so sometimes you might think the opposite. You might think, oh, I don't like that, so I'm not going to do that. Okay. But obviously if it's excruciating, I don't want you to come back from it. But if it's a feeling that you feel like, that feels a bit uncomfortable, but I can...
It's almost nice, like...
Exactly, exactly, yeah. So you'll get to a point where it will eventually feel nice, okay? In the beginning, obviously, you're in spasm and there is pain going on, so it's going to be a bit uncomfortable. But I want you to just keep challenging those barriers. And each time you do this, I want you to try and just push that barrier a little bit further.
That's fine.
Okay, so this one, and you can also do one, so take a seat for me, because obviously this will be hard to do if you're at work. So I want you to have a seat facing this way, and I want you to just pop your foot up onto your knee like this. Sit up nice and straight, so your back is nice and flat. Then you're going to hold on to that knee, and you're going to lift the leg up towards the opposite shoulder. But what I want you to avoid doing is leaning back like that. Okay, so I want you to keep your body upright, and you're going to lift that knee up, so your knee is coming close to your chest. Okay, and as you do that, I want you to rotate the opposite way. Okay.
So this way for me? Or is it this way?
Yes, towards me. Yeah.
Okay.
Can you feel that?
Yeah.
Okay, so these are the two stretches that I want you to literally do as much as you can.
And am I doing it on both legs or just the one?
You can do both. Okay. Yeah. When you have the type of issue that you have, it can actually switch sides. Okay, so you can have it where it gets completely better here, but then it starts tightening up on the other side, and that's simply because there's an imbalance. So the muscle spasm then starts happening onto the other side. Okay, so if that does happen, don't be too surprised. This is just part of the process. You will get through this. You will get better. Everything else that we talked about in terms of your activities, do what you normally do, just take it slowly.
Do you think I shouldn't do any weights at all at the gym, or do you think it's all right?
I would say if you want to do the movements, I would say do the movements. I wouldn't say to load it up too much, because when you load it up, you're going to be condensing tissue and you're going to be tightening things.
So you know, like when you do, I don't know what they're called, but you know, like when you do the kind of like leg like that or leg like that, that's okay, just with minimal weight. Yeah, I would say doing that and just getting your range of motion is fine. Okay. Yeah, and actually be helpful. If you're loading the tissues where you're having to contract them quite a bit, I wouldn't say it's the worst thing, because sometimes I have people who come here who are athletes and they're training and they still need to go through rehab. So I don't stop them from training, but I say to them to recognize that you can tighten things up by doing that. So remember we talked about the balance, about kind of working on loosening, and then there's certain things which tighten. That is going to feed into the tightening. Okay, but I'm sure you're going to be good with it. If you're just consistent with this, you're going to get through this pretty well. Okay? Yeah.
All right, I'll let you get changed up and just come on through when you're ready.